You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, advances in pain management. With us, we have the desert's leader in pain management, Dr. Roland Reinhart. Dr. Reinhart, welcome to the program.
Thanks for having me.
Now, you are the go-to guy in the desert. That's what they say about you.
Is that what
now,
they
you've been
say?
there over 25 years, right?
Well, I've been there, yeah.
And that's
since
all you
91.
do is pain.
Exactly. So it's great because, previously used to do pain and anesthesia. That was my background. And now I just do exclusively pain, which actually it's a much more exciting field to be in. I mean, anesthesia is nice, you put people to sleep, but now you get to help people with their pain while they're still awake.
And people that call that are in pain, you do take same-day appointments.
Oh, we do.
Is that right?
If you have horrible pain, if you just call and say, I've had pain for 40 years and I'd like to see somebody, well, we may wait a little bit.
Well, you just tipped them off. Now everybody's going to call your office saying, I'm in excruciation pain.
Oh, that might be. Okay.
But you do see people in the same day.
We do. We see a number. We probably every day have about 5 patients we add on, maybe more, that call that say, hey, I'm in horrible pain. I need something done.
Okay.
Absolutely.
So for people that don't know your practice, and we're talking about the newest thing in pain management right now.
Right.
I mean, it's really brand new. I mean, it's like breaking the news here today. But let's talk about everything you do first. Like, what are some of the things you do, and what are some of the conditions you treat?
Sure. So we treat, a wide variety of conditions: arthritis, cancer, aches and pains, sprains. We do a number of things for, migraine, headaches. But probably a lot of the things that we have out in the desert are people involved with athletes. The desert is generally speaking, they're a bunch of active people, so they're playing golf or tennis or whatnot.
Like 70, 80 years old, 90 years old playing golf.
Absolutely. The other day I was happy my mother was turning 90, and that patient came in and I was telling her how my mom was 90. She says, oh, that's wonderful. When I turned 90, she goes, I'm 92, and it was wonderful, the party I had when I was 90. The next guy was 95. So there's a lot of active people.
Nice.
And as we live longer, a lot of things wear out. So people, golfers, tennis players, whatever, or just people with wear and tear over time may need more health services as we live longer. And pain is unfortunately part of life that's going to come oftentimes with living longer.
Okay. Now we've had you on the program talking about electronic stimulators, the next generation, for people that want to get off medication and control their pain. Now this newest thing, like Vertiflex or the mild procedure. On the phone, we were talking. You're pretty excited about it.
It's an exciting time. I mean, it's really some great things that we can do for people with, minimally invasive techniques to actually help control their pain and to make a change, an anatomical change. So things like the stimulator, the upside for that is we weren't cutting into their body. We weren't taking parts out of their body. We weren't doing anything to address that. We were basically able to successfully block their pain. But now with these new techniques, we're able to, in a minimally invasive way, take out pieces of tissue or expand the area around nerves to where they'll get relief from pain, and it's actually an anatomical change that actually then holds up for longer than maybe an epidural. I mean, epidurals are great, been around a long time. They work about maybe 75% of the time for a lot of patients. But for some people, you get an epidural, you get some relief. Get another epidural, you get some relief, but it never really gives you kind of the long-lasting relief that you're looking for. So these new techniques, one of which is mild, which basically thins out the ligament in the spinal canal, which opens the canal a little bit, relieving the pressure on the nerves, can give you excellent relief.
Okay.
The other technique called the Vertiflex is insertion of this is so smart. This little titanium device that spreads the bone apart and just frees up the nerves a little bit, gets rid of any pressure on the nerves from stenosis, and actually can help improve patients' pain dramatically.
Okay, now, you showed me in our green room a spine and what it's doing. I've seen a video about this that we're going to show a little bit later.
Okay.
It really helps help me understand what this is. But most of the pain, like leg pain, back pain, is something is pinching or pushing against the nerve.
Right.
Right. So most surgeries are performed to remove that pressure on the nerve.
Exactly.
Is that right? So now This is what?
So specifically, this is indicated for what's called neurogenic claudication. And what neurogenic claudication is it pain when you're standing or walking? Because when we stand, we basically, bring your hips forward, put a little curve in your back. When you do that, it closes a space around the nerves, and that may put pressure on the nerves, okay? And that's why these people get pain. So if you're, the kind of person who's, walking a certain distance and you find you start leaning forward, or if you go to the grocery market. So you lean forward,
it relieves the pain
right, because it opens it up. So these people, otherwise they're looking for a chair to sit in, okay? Or they go to the grocery store and they're leaning on the grocery cart, okay? So in those cases, when they're having pain down the leg, related to standing upright or walking upright, these are the people where this therapy is ideal
this new
for.
VertiFlex.
VertiFlex and Mild, both of these procedures are helpful with that.
So people that get relief from their pain, either sitting, maybe with their legs up, or bending forward.
Bending forward, right.
Is this spinal stenosis?
Spinal stenosis, exactly. So mild.
And define that. What is spinal stenosis?
So stenosis just means narrowing, right? If we just said you had spinal narrowing, as a doctor, we couldn't charge much. So we call it stenosis, okay? So spinal stenosis is just narrowing, and there can be a number of different reasons for it. One would be you have a bulging disc. One would be there's a ligament thickened up. Another would be that you have arthritis. Those are the three big ones. There's a couple others. Your spine could be out of place. That is, you might have slippage of the bones themselves, or you could have a cyst in the spinal canal. But the big three are basically a bulging disc, narrowing because of arthritis, or thickening of the ligament.
That are pushing against the nerve.
Correct. Okay. Narrowing the space there.
So the current options are what, and what are you doing now with this new technology?
Right. So typically the standard sort of continuum you'd go with is you do an epidural, maybe they do physical therapy, they do chiropractic care. So for the patients who have, back pain that's just not going away, okay? A lot of times it may just go away over a few weeks or whatever, but if it's just persistent, then the continuum would be, they'll do some physical therapy. Then they may take some anti-inflammatories, Advil, Aleve, maybe they have chiropractic care or whatnot. And then we may look at doing an epidural steroid injection for the patient, right? That'll help take down swelling and inflammation, but doesn't really change the anatomy. But oftentimes getting the pressure off the nerves just from the steroids will help to alleviate the pain. So oftentimes you can take steroids or have an epidural steroid injection, and that may alleviate the pain. Sometimes though, you may get relief for a few weeks or whatnot, but it doesn't really hold up for you over the long haul. Then the option, we're looking at is, wow, are they going to need surgery because we can't do anything else to get rid of their pain?
Like the epidurals over time stop working because something is pinching that nerve or pushing against it?
Correct. There may be progression of what's going on, either the ligaments getting thicker or arthritis worse or bulging disc or whatnot. So, the question is, are they, in the old days, old days, the option was, well, you go to surgery. If nothing else is helping, you go to surgery. But these people often may just have moderate spinal stenosis. And so, to go to surgery to just do a small thing for them seemed like an awful big leap to all of a sudden now you're going to invade the body, cut out bone, cut out ligament, cut out disc. So these newer procedures now, which actually, I think are going to revolutionize medicine, much like how there's very little cardiac surgery done these days. Now it's all done, by cardiologists with catheters and tubes, and they dilate things. So likewise, pain management is going to, I think, revolutionize a lot of spine surgery to where people may be able to get relief from these, less invasive techniques and have just as good of outcomes. So the first one, the mild procedure, essentially focuses on one problem, which is when the ligament is too thick, and if that's causing pressure on the nerves. So the mild procedure goes in, and essentially you sequentially just remove little bits of the ligament to just open the spinal canal a small amount, but that may be enough to alleviate pain.
So you go in and under scope, and you're shaving the ligament,
right,
that's in front of the nerves to give more space so they don't have the pain.
Yeah, it's a ligament at the back of the spine.
Back of the spine, okay.
At the back of the spine that basically has crowded in over time because of degeneration of the disc. And so when the ligament's too thick, it's taking up space in the canal. And so you can go in and you can shave that out and actually just increase the space there. Oftentimes I've had patients with ligaments that might be 7-8 millimeters thick. You resect that down to 2 millimeters. You just added 6 millimeters to the epidural space. So all the patients we have, and interestingly, the mild was approved by Medicare done a lot. Then Medicare pulled it back and wanted to have it restudied. We were part of 15 centers that did the restudy, and the only way people could get it was to basically be involved in a study. And all the patients that we treated in that, all of them had significant improvement in their ability to walk, stand, and basically improvement in their daily activities.
So this is just the newest in minimally invasive spine surgery in a way.
Correct.
Right?
Correct.
Okay.
And it is in some respects. It's been around for probably 4 or 5 years. Again, because there was this restudy and Medicare said we're only going to have people involved in the study. And again, we were one of 15 centers in the country that did this throughout the study period. And so the results we had really were people who dramatically had improvement in their ability to stand and walk. 2 of them I can think of it. And interestingly, they seem to be more of the overweight patients. One of whom was like not a candidate at all for surgery, and these people had their time that they could stand was maybe 5 minutes. It was very restricted. Life sort of occurs in 15-minute increments. In 15 minutes, you can get up, make a sandwich. You can, go to the bathroom, whatever. But when you're, you can only stand for 5 minutes or so. You're not going to do much in life. So these people, their ability to walk further, their ability to stand was increased probably 6-fold. So it's a dramatic difference in improvement in their life.
I don't think I understood this concept until today. So everything, when treating back pain, especially if it's coming from the nerve, that it's to try to push your tissues, your body away from that nerve. Is that right?
Well, it's to open up the space.
So that way the nerve is not pressed on or irritated or rubbed.
Exactly. So surgery, the first part of surgery is always, if you're going to have surgery, it's called decompression. So the problem is that there's too much pressure on the nerves, kind of like a pressure cooker. And so
it's being squeezed by the anatomy?
Correct.
Okay.
Correct. So what you're trying to do is open the space and just free up the pressure on the nerves, get the pressure off the nerves.
All right.
So the newest, most really exciting and revolutionary thing going on now is this new technique or procedure with Vertiflex. And what Vertiflex does, I don't know, I showed you a video.
Yeah, so we'll go to the video in just a moment. But again, who's the ideal candidate for this newest procedure, this Vertiflex?
Right. So the best patients, again, the indication is for what's called neurogenic claudication, which is people when they're standing or walking, or having pain, and so they tend to bend forward, or you may also notice that they go to sit down, okay, which also opens the spine, or you'll see them often leaning on the shopping cart at the grocery store, which where we live is like half of the people.
So you could spot these people that you could tell are getting pain relief from moving forward.
Absolutely.
Because it opens up the spine.
Absolutely, and the patients know that. I mean, I had a gal in just yesterday. She described perfectly exactly that. She can be up about 10 minutes, and then she's looking to sit down. She says if she goes to the grocery store, she can lean on the cart and walk through the whole store with no problem. So the difference is when you lean forward, it opens the space around the nerves. When we stand up straight, because we put our hips forward and we put a curve in our back, we start putting pressure on those nerves. So what's great about this Vertiflex is it basically holds the bones apart, leaving more room for the nerve, just like you would if you were sitting. So even though you're standing, those segments of the spine are kept from closing down, and that alleviates the pressure on the nerves.
Okay, now let's go to this video. And I'm going to tell you, anybody watching this is like one of the best animated videos I've ever seen. I mean,
it's excellent.
Really, it helps you really understand this. So let's go to the video. It's about 2 minutes long, a little more than 2 minutes, but it's really good.
Great.
Let's go.
The procedure can be performed in either the hospital operating room or an outpatient surgical center. This simple procedure is done through a small incision made in your lower back. The Superion implant is placed between the vertebrae and holds them open. This relieves pressure on the nerves in the spinal canal. When the Superion is placed, the device arms are opened and surround the spinous process. This helps in preventing the potential of the Superion from dislodgement. After the procedure, you may enjoy significant reduction in leg pain within the first few days. Your doctor will review post-operative care guidelines with you. This will let you know how to care for the surgical site after the procedure. Your doctor will also talk to you about limiting your activity levels immediately after the procedure and how to increase activities as you heal. Certain risks are associated with the use of the Superion. Consult your doctor for full information regarding these risks. If you have been living with leg pain from moderate lumbar spinal stenosis, you know the toll it can take on your day-to-day life. Superion is a new medical treatment that may allow you to have a more active future. Start enjoying your day-to-day life again.
Wow. I mean, it looks pretty easy. So you implant that at your center?
Absolutely, absolutely, yeah. So the great thing about this is it can be done in an outpatient surgical center. You can do it in the hospital as well. It's a lot less expensive to do it in a surgical center. The patient has minimal anesthesia. It can be done almost with just local anesthesia or very light sedation.
So you're just kind of clamping it open a little bit. You're just opening it up.
Exactly.
Like mimicking what they feel like when they're sitting down.
Exactly.
Or leaning forward.
Actually, it's really brilliant. I mean, it's so simple. You know, in life, there's some things that are just like so simple. It's just like brilliant. So it's the great thing is over a 6-year study, very good improvement in pain. About 80% of patients, even at 6 years out, have relief of their pain. There are some patients it doesn't work for, but by and large, the patients, again, it's patient selection, it's getting the right patients.
So you can spot this on imaging. You can say, wow, this would probably be good.
Right, so we're going to get an MRI, and we're also going to take x-rays of them bending forward, standing up straight, and bending backwards, because we want to make sure there's no instability in the spine where the bones might be moving around. Again, you know, the nice thing about this, we're not even invading into the spinal canal. We're actually placing this in the back of the bones, you know, where as the video demonstrated.
Like the bumpy parts on the back of your back.
Right, and
you're kind of putting it in there.
It's called the spinous process, right?
All right.
So as the video showed, where it's clamped on the back, so we're not actually even cutting into the spine. If for some reason you had continued progression of disease, this kept bulging, whatever, and you had to have surgery, we're not invading any part of the surgical space where the surgeon's going to go. So the great thing is you can put this in. It's simple to put in. The patient doesn't need sedation for it. There's minimal downtime. After the procedure, we'll have them just limit how much they're bending and twisting and whatnot. But it's got very limited recovery time. Nothing like having spine surgery.
So the person that had to bend forward to relieve their pain or sit down or put their legs up to relieve pain, this gives them the same relief.
This device is essentially holding those segments of the spine open just the same as if they were bending.
How come it took so long for them to figure this out?
It's great.
Because you say it's an ingenious...
It really is. And I think, like a lot of things, I mean, open heart surgery got to be, you're bypassing more and more vessels, and finally you're kind of going, do we really need to be doing that much?
When you saw this, because look, when you look at the video, it looks very simplistic. Did you think, why didn't I think of this?
Yeah. Well, don't I wish? How about Velcro too?
Yeah. But I mean, is it one of those things in your industry where you're saying, wow, this is really...
It really is. Well, I'm sure people come up with clever ideas all the time, and then you just kind of think, well, whatever. But actually, this product I think is going to help so many people, and in particular people who you have epidurals. I mean, I see this in my practice.
Yeah, give me a scenario of who would really benefit from this.
Yeah. So we have we have a number of patients that we've given epidurals for, and I always feel bad if they say, well, I had an epidural, a year ago, or whatever, and I just kind of still had pain. It didn't really help, so I just stayed home, and maybe their primary care doctor gave them some pain medicines or something. And I feel bad for them. I'm like, well, why didn't you come back? I mean, there's other things we can do for you. And now we have something. So
epidural's just the starting place.
Yeah, epidurals may
But if it keeps wearing off fast, then you could do something else about it.
Exactly.
That's where you say you feel sorry for them.
Exactly, and it's something that's much less than having to do surgery. People who have a surgery have a laminectomy. The reoperation rate within 2 years is anywhere from about 6 to 34%. So I see that all the time, and I will admit, my view of surgery is somewhat tainted, and I will say, if you need surgery, you need surgery. So don't think that just I'm saying you can avoid it.
Laminectomy, I learned the name about an hour ago from you.
Right.
But this is where they cut the bone.
They'll cut away the bone
to take the pressure off the nerve.
Right. And so what?
But then you're messing around with you're with the physiology of the person, and you could potentially make the spine weaker.
Well, you're taking out
kind of implied.
Right. I mean, if you think about it, the bony part of the spine is there to support the nervous system, the spinal cord. Okay. So if you start taking out a lot of that bone, then you may have to go in and do a fusion to stabilize it.
Eventually.
Exactly. Well, maybe eventually, or maybe the first time you go in, maybe you do a fusion, because the natural history. I mean, the surgeons know the natural history is that there's going to be deterioration. So if
by removing that little bone,
if you just take out the bone, the patient may have symptoms come back again.
So when I see these commercials with the little Band-Aid,
right?
Is that what they're doing? That's the bone procedure we're talking about, where you remove the bone?
Well, you know, for the people that do the little Band-Aid, if you will, they are sort of, let's say, admitting that to go in and do a big surgery, and there may be an indication for doing that, but their feeling would be a lot of surgeries could be a lot less. The trick with spine surgery is always to do enough and not too much. So the people who are doing, you know, minimally invasive kind of procedures, and you can get that done by, you know, a number of surgeons. There's one company advertised a lot, but a lot of surgeons will do those minimally invasive procedures. They will recognize and they will tell the patient, look, we're just going to fix this one thing. There's other things that may happen. So when you do less procedure, but you're still taking out bone, you're still taking out disc, you're still structurally adjusting that space, then you may have a chance that other things are going to deteriorate, okay? So with this device, we're not cutting anything out. We're basically just supporting the structure that's there.
Like scaffolding in a way, or some kind of...
Could be precisely like that. We're holding it open so that the pressure's not on the nerve.
And how long could it last?
So far the studies go out to 6 years, and
really?
with the same kind of results in terms of relief, particularly leg pain, about 80%. And additionally, while leg pain was a primary thing we were looking for to try to get the pressure off the nerves, and that would give you pain down the leg. Additionally, though, people with back pain, there's about 68% or so people out 5 years still have relief of back pain as well. So the primary thing was the legs, again, 85% or so relief of pain in the legs after 5 years, but also back pain. About 65% of people at 5 years have improved back pain.
So this is great for leg pain, like sciatica.
That would be the primary thing, right?
And you get, I want to show a little bit of that clip one more time for people that are just tuning in. We're talking about the newest implantable device to, I guess, relieve pressure that's caused from something pinching the nerve.
Stenosis, right.
Or
Stenosis
going in, that's what stenosis
from any
is.
reason whatsoever.
Okay.
Yeah. Whether it's a disc or arthritis or whatever.
So what we're looking at here, you just do the procedure, implant that little, that's
Correct.
what we're looking at.
Correct.
Just implant it in, it opens it up.
Right, and it's a very simple procedure to do, done again with just, for the most part, local, little bit of sedation, you know, very different. You know, even with the smallest laminectomy, they're going to put you to sleep. Even the smallest minimally invasive surgery, they're going to put you to sleep. This doesn't require for you to be put to sleep. So people who, you know, are too debilitated, maybe they have other health conditions, they could still have this procedure. And I think those are a lot of those people who, you know, are sitting at home going, oh, there's nothing that can be done. The surgeon told me nothing can be done. Well, you know what? Something can be done.
And people don't want surgery. Period.
People
right?
generally don't.
They put it off and put it off, and they're living in pain. This is one of those non-surgical. I mean, it's surgical because but you're not touching their spine. I mean, you're not carving anything away. You're not doing anything. Right?
We're not in the spinal canal. It's just sort of like we're just providing support in a way that basically provides a better opening for the nerves as they exit the spine and keeps the pressure off the nerves.
And how soon before they feel relief? Because it seems like it'd be immediate. Just like when you lean forward to relieve your back pain. Is that the way it is with this?
Exactly. So you will have an improvement right away because it is kept open. There are some patients who will have some back pain. In our experience, the patients we've had, some of them, about 6%, have some back pain temporarily after you put in the device. Again, you're putting a device up against the bone, and bone has some nerve endings. But typically that resolves within a very short time. And so I think it's really I won't say a miracle, but pretty close to that in terms of, you know, what are your options? You know, with the options where you had shots, okay, can't keep having shots. What are you gonna do? Take narcotics? Okay, well, now there's the problem with addiction and so on. Okay, well, you're gonna go to surgery. So now in between, you know, just having the shots and having surgery is this incredible device that just really is a wonderful opportunity for people to get pain relief without having to take medication.
It looks easy to do. You showed me on a model using the exact tools right in our green room. You did it right. You stumbled a couple of times, but well, because you were on a book.
It was a little hard.
But it was pretty easy. You just put it in, and it's there. You come out, and that's it. It's no downtime at all. Is that right?
It's a simple procedure. Downtime would be, I would say no downtime.
You just want them to take it easy.
Some limitation. Yeah, we don't want people, going out doing, skydiving.
And what is that called, by the way? What is it? So when they ask for this, when they call your office, what is this called?
It's called Vertiflex.
Vertiflex.
Vertiflex is a product. It's made by Superion.
A year from now, you come back on the program, and you've done a lot of these.
Yeah, hundreds.
You're going to have story after story after story.
I will.
Is that your prediction?
I will.
This will be the best thing you do, you think? Like
this
the newest
is gonna
best
be,
thing?
This is going to be the best thing in terms of giving people consistent relief over a long period of time, and something much better than just doing an epidural.
Okay.
I mean, we'll do epidurals, we'll see if they get better, great. But if they don't, we now have another option for them that will allow them to get good relief of their pain, again, from neurogenic claudication. So it's a great option.
And you work with the orthopedic or the spine surgeons in town. So if they're not a candidate, you're going to send them for surgery. Because you told me clearly in the green room that if they need surgery, you're going to...
Oh, absolutely. If there's a clear indication for this, it fits in a very clear space. I think a lot of people are going to find that this is firstly, this is an option they never had before. So now you have this option, and I think a lot of people who either stayed at home and said, I'm just going to put up with the pain, or taking narcotics, as opposed to having surgery, or those people going to surgery now have an option to say, hey, you know what, I'll have something less than a major spine surgery. So it's a wonderful option.
But the problem with all these procedures, like even with back surgery, is you got to redo it all the time. Is that the case with this?
Yeah, well, so for this procedure, which again, a minimally invasive, people that may have to go to operation, okay, or reoperation, whatever, the statistics show that in 2 years, about 14% go to reoperation. Laminectomies, anywhere from 6 to 35% of people have to go have reoperation. Again, if you look at people who have to get rehospitalized for complications from laminectomy, standard laminectomy, that's about 9%. Incidence in a 2-year study of this was 0. Causes for stroke or heart problems, wound complications, neural injury, about 2.5% for standard surgery, wound complications 3%, heart or stroke problems about 3%. All those with a standard laminectomy, again, because you're having major anesthesia, you're having a lot more done. With this, 0.
We have about 30 seconds, but what are the spine surgeons or the orthopedic surgeons saying about this new procedure?
Yeah, so I showed this to a neurosurgeon, and they thought it was actually incredible. And the nice thing about it is that it's not really, the surgeons will have plenty of work to do. I mean, there's still people going to have problems. Yeah. But what it will do is patients where, they had minor problems that they really don't want to operate because it's, like it's too early, the disease isn't bad enough, now they don't have to do those kind of cases. So now we can use this to bridge the patient. If they progress, then the spine surgeons, have those cases. So it's really, again, just a great tool, for everyone in medicine. And I truly believe all doctors want everybody to feel good. Okay. So and not with narcotics, but they want them to feel better and have the best possible outcome. So whether it's this or whether they need surgery, basically it's the best option for everyone.
So as a quick recap, so for people that have back pain and they get relief by bending forward or sitting down, that this would be great for them.
This is a perfect kind of thing for them, absolutely.
Without medications.
Absolutely.
Okay, good. Dr. Reinhart,
Great.
Always a pleasure to have you on the show. We always run out of time, so thanks again.
Thanks for having me.
You've been watching The Wellness Hour. I'm Randy Alvarez for now. I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.